Hello trach warriors, my name is Bux. My wife Karen asked me to make a quick video on how we've been dealing with her tracheostomy. She has got idiopathic subglottic stenosis. Idiopathic means they don't know what's causing it. Subglottic, just below the vocal cords. Stenosis, a narrowing. So her tracheostomy is narrowed just below the vocal cords, and as a result of that she's had a tracheostomy since 2018, and this is how we care for it. So I'm going to show you how to manage this thing without going crazy, because this is a traumatic thing to have a tracheostomy, and the quicker you learn how to take care of it, the better off you'll be. Hello trach warriors, my name is Bux. My wife Karen asked me to make a quick video on how we've been dealing with her tracheostomy. She has got idiopathic subglottic stenosis. Idiopathic means they don't know what's causing it. Subglottic, just below the vocal cords. Stenosis, a narrowing. So her tracheostomy is narrowed just below the vocal cords, and as a result of that she's had a tracheostomy since 2018, and this is how we care for it. So I'm going to show you how to manage this thing without going crazy, because this is a traumatic thing to have a tracheostomy, and the quicker you learn how to take care of it, the better off you'll be. Okay, let's talk about cleaning your tracheostomy. So there are two types of cleaning we do. One is the daily continuous, as you're living, every time it's dirty you need to clean the thing, and the other one is every now and again when it's time to clean the whole outer cannula, you need to clean that as well. And the two processes are different. So the one I'm first going to talk about is how to clean this inner cannula on a regular basis, and you do this many times a day. So remember, this is a foreign object. It's in your throat. It irritates. So there's a lot of coughing when you have a tracheostomy. So this thing gets full of spit and all the stuff coming out from your lungs the whole time. Now, I've heard people use a lot of things. So one thing that people use, and you'll get this stuff with your tracheostomy, is this thing. This thing is not supposed to be used to clean this on a regular basis. You do not want to be sticking this thing in your throat while you've got it in your tracheostomy. This is used to clean it in the odd event that you take it out, or that the doctor takes it out. So we're talking about cleaning this one. So once you cough in this, it's going to be full of phlegm, and you need to clean that and not let it get crusty. The quicker you clean it, the more supple it still stays, and the easier you can get this clean. And you can keep this thing clean for a very long time. It's my dogs. On average, we clean this probably about 20-30 times a day, and it's an easy process. It doesn't have to be traumatic, and I'll explain to you how we get that done. So I've seen people that say that you need to suction this, and you use this thing. This is a traumatic experience to suction, and you need to know how to suction to do it properly. You're not supposed to go past the end of the cannula and suction any part of your trachea. So we don't use this. This thing is in the attic the whole time. We never use it. We made a different plan. So what we do is we use one of these. This is a teeth aqua flosser that basically squirts water at high pressure to clean between your teeth. You don't have to get an expensive one. Get the cheapest Chinese knockoff on the market that's inexpensive, but you want some force around this thing. I don't know how you can clean your teeth with this, because this will take your gums off. It's like a high pressure cleaner. It's got a water container and then a little tube that goes into that, and you basically, what you do is every time you cough, you take out this inner part, because remember, this part stays in there. So you take out the inner part, and this will be full of spit and stuff, and you basically just squirt this clean under the sink. And I'll talk about the solution a little bit later. What we've done with this, just to make it easy, is we use one of these. It's just a normal mustard condiment squirter, and we use this to basically fill this piece, because you use up the water in here quite often, quite quickly. That's what we use, and this we then fill up with our bigger container that's got the cleaning solution, and you just top up this one and use this to fill that small one. This became a bit cumbersome, so I made a plan by just basically cutting off one of these tops and hot gluing it into the bottle top. So now we don't need to refill that one. We basically just squirt it into this one. And when we make this solution, we make it about every 2-3 days. We probably go through about 4 of these bottles of 2 in 2 days. So get yourself a bunch of cool drink containers. Once they're empty, wash them out properly, and you can use these. Just make sure you mark them so that you don't actually think that it's water accidentally and drink this, because this is not water. What this is a hydrogen peroxide mixture. We use this to clean the tracheostomy. It disinfects. Since we've been using this, Karen hasn't had a major tracheal infection in years. So this works beautifully. What you do at your local chemist, you get this. It's hydrogen peroxide. You ask for the 30 volume or 9%, and get yourself a nice big container of this stuff, and you basically fill these bottles. And the way you do that is we use this, which is out a bit. So you get yourself a nice measuring jug. You're going to use this only for this purpose, so get yourself one that you can dedicate to this purpose. Get yourself a nice big 60 ml syringe. And what you do, hydrogen peroxide, you don't want this to get onto your skin, because it will burn your skin. It'll become white and flaky. It's not that dangerous, but it's concentrated in this form. So what you do, you take this, you pour a bit into the jug, you line up your empty bottles, take your syringe, pull up 30 milliliters of the concentrated hydrogen peroxide, and basically squirt it into each of these bottles. And then once you've got all your bottles full, you just fill them up with clean water. We've got an under-counter filter that basically filters our water. You don't have to use sterilized water. If you've got access to it, great. We don't have access to sterilized water in South Africa, so, well, not easily. You have to buy it, but the tap water is good. The under-counter filters it nicely. Make this. Nitrogen peroxide is going to clean this out anyway. So one thing, a quick little tip. The reason you pour it into this jug is you don't want to be trying to pour this stuff straight into that bottle. You're going to spill and you're going to mess up, and you're going to burn stuff and make marks on your table and so on. So pour it in there, suck it up with a syringe, squirt it in. Remember, first the acid, then the water, not the other way around. Otherwise, you're going to get a reaction. And then what you have to do is you pour what's left over back into your big container, and then just make sure that you rinse this properly, because this little rubber bit, put it up like that after you've rinsed it off. You don't want this to be full of hydrogen peroxide, because it will eat this. This one is probably about, I would say, a year old, and it hasn't gone anywhere because I clean it properly with just clean water after the fact. Make yourself a whole bunch of these, 6-7 bottles, however many you want. Keep them in close by, because you're going to be filling this thing regularly to clean the trachea. And this is a fairly simple process. You don't have to do the suctioning. It's difficult, it's noisy, it's traumatic. Take one of these. We've got many of these that have died. it's easy to travel with. You put this in the car along with this, and you've got an easy travel kit. If something happens to the car and you need to immediately clean it, just pull over, squirt it out, and you're done. Once this is mixed, it's really not bad. It's fine. It doesn't burn you or anything. You don't have to use gloves. I basically hold it like this and I squirt it into the end over here, over the basin, and it makes a bit of a mess in the basin, but it won't burn you or anything like that. It might have a slight smell to it, but the solution is strong enough to make sure that it will kill most bacteria and things, and stop any sort of bacterial growth, but it's mild enough that it's not going to burn you or anything like that. So basically I squirt it off. Don't rinse it under the tap after you've cleaned it. You want to just basically just shake it off a couple of times. It doesn't matter if there's a couple of drops on there, it's not going to do anything. And you can put the inner cannula back into the tracheostomy tube. And it's as simple as that. And the solution we've used for a long time, and it works great.